Hello! In this video, we will talk about the glass door project that will be piloted soon in PICU. The glass door project is a tool to improve communication and efficiency in patient care in PICU. It allows the entire team to see what the goals are for the patient at any time of the day. This format and level of information that will go on the glass door project has been vetted and approved by the HHS Privacy Office. This idea was borrowed from Montreal Children's Hospital. It has been tried and tested there and shown to be well received by clinicians as well as families. In the past, we used the Daily Goals checklist to ensure we developed systematic goals and plans for our patients. However, this didn't work well, as it was unclear who was to complete the Daily Goals checklist, and often it was not referred to. As a result, some plans were not well understood and not well communicated between team members, subspecialists, and families. Your feedback on rounds and the Daily Goals checklist was very valuable. Here's what some of you said. You said we needed to improve the Daily Goals checklist, that there were too many lists, too much paper, and inconsistent communication and collaboration amongst teams. Therefore, we took your advice seriously. We got rid of the Daily Goals checklist. And in order to improve rounds, we developed the glass door project. In the pediatric ICU, one patient can be under the care of several nurses, physicians, and allied health professionals, each of whom has an essential role in carrying out the patient plan. With so many team members working at various points throughout the day and evening, this glass door project will improve team communication, which is essential to deliver efficient patient care by the PICU team and any other subspecialties. In addition, the glass door helps to develop individualized patient goals and plans, facilitate regular sustainable implementation of Liberate bundles to every patient every day, and it ensures shared responsibility for the patient, PICU team, clinicians, and the family. The glass door consists of goals and targets for various systems, which will be decided every shift and at any time during the day. Anyone involved in the patient care, MD, RN, RT, PT, etc., can write what the actual progress is and indicate whether the target has been achieved or not. You will notice that not every system is listed on the glass door template. This is to avoid overcrowding. We also wanted to include targets that are dynamic, that we should respond to during the day, and some targets that might be missed or be challenging to discuss. It also includes a review of planned tests or procedures, the need for lines and catheters, and whether the patient is enrolled in a study, and if he or she is ready for discharge. How does the glass door project work? When and how can it be used? During rounds and after the head-to-toe report of the patient progress by RN, RT, PT, pharmacist, and dietitian, the MD will give an overall impression of the patient, or for complicated patients, the impression according to each system with an objective goals followed by the plan on how to achieve that goal. All the team members are invited to participate in goal setting and making plans, and any team member can review the goals and plans at any time during the day. The goals and plans should be short-term for each shift. Current progress describes the progress of the patient in achieving the goal or target. The yellow indicates that achieving a particular goal in any system is still under progress, and the team is working on it. Green indicates that the target was achieved and it's time to move on to the next goal or target. In this way, goals and plans are dynamic and changing according to patient need, meaning they don't have to wait till rounds for a plan to be made. We will give you an example how goals and targets can be listed on the glass door template. Ava is a 5-year-old girl with ALL, admitted to PICU with septic shock. After reviewing her progress from head to toe, the team set her goals and plans for the shift using the glass door template as follows. For awake and sleep, our target is a pain score of less than 4, RASS of -2, and CAPD of less than 9. Therefore, we will drop the fentanyl infusion from 3 mics to 2 mics per kilo per hour. We will start using the WAT1 score as she's at risk of withdrawal due to prolonged use of an opioid. From a breathing perspective, our goal for the shift is to reach an FiO2 of 40%, and to achieve that, we will begin to allow permissive hypoxia and hypercapnia. Oxygen saturation of 88% and above will be accepted. We will decide about adjusting other ventilation settings accordingly. From a CVS perspective, the target for mean arterial pressure is above 55 millimeters mercury, and the goal is for the norepinephrine infusion to be at 0.05 mics per kilo per minute by the end of the shift. We want to achieve that goal by reducing the norepinephrine infusion by 0.02 mics per kilo per minute every hour. For diet, the goal is to start trophic feeds at 5 mils an hour. For mobility, to be started on in-bed mobility. No line or catheter is to be removed, and the patient is on the squeeze study. If any target is achieved, for example, reaching the target of FiO2 of 40%, the RT can tick green, and then, to ensure we have dynamic progress, they will set a new target for FiO2 or ventilation. Thank you for your efficient care. Please do not hesitate to reach out to us for more information about the Glass Door project, the Liberate implementation team.